off. And before we do kind of jump into the sessions, Sarah Grant is on a much deserved vacation as well today. So I'll just give a brief update on the two transportation bills. And then she did provide some additional text that will go out in the written update in the CMO weekly update. And then as well, my camera doesn't seem to be wide enough, but I have Shaylee here again, our intern, and she's actually going to present one of the new bills that we thought would be interesting for council to hear today. So that should be fairly exciting. So let's go ahead and just jump in. To kick us off, I think the biggest thing right now that's hitting the news is there is a massive to-do list right now for the General Assembly and very little time left to get it done. So there was an article that came out in the Sun that said there are 250 pieces of active unresolved legislation as of today, so May 21st, and they anticipate some additional large bills to be introduced today and throughout next week. And in this list of 250 active bills, they are huge bills. One is the state's transportation funding system, an overhaul of the healthcare industry, and now these equity-focused reworks of the tax code that were just introduced last week, in addition to a bunch of criminal justice reform bills. So again, we're in the meat and the fun of the legislative session, but they are running out of time. So if they have to either stop at 120 days, which is June 12th, or they have to have a request for a special session, which takes a 2/3 vote. I don't know if you read the articles. They're very optimistic. The leadership is very optimistic. They're going to get through the important bills. There's been rumors about with Republicans and filibustering and extending the debate time to kind of slow things down. So we'll just continue to monitor and see where things land, but we are getting into the end of the session. In addition to the 250 active bills that are out there, they also still need to do the $900 million stimulus package funds, get all of that allocated. And then there's the $3.8 billion that they got in federal aid. So again, just a bunch of things happening, and we'll continue to track. And hopefully they're able to get it done by June 12th. Originally, we had talked about them recessing this next Friday. That hasn't been mentioned for about a month now. So I don't anticipate that happening, but if we do hear that again, we'll bring it back up. And then just one other general update, Governor Polis did sign the fiscal year 21-22 state budget this week, which was originally Senate Bill 205. It's a $34.1 billion state budget. It starts on July 1st, and it is $4 billion higher than the current year budget. And just a reminder, we talked about this before, but some of the cuts that were made for the current fiscal year have been restored largely around education. So K-12 and higher education, which saw massive cuts in 2021. And the JBC and the governor has called it an investment in our children and an investment in our future, because they've also been able to save a historic amount for future economic downturns. So that was kind of exciting news this week, and the economic modeling for the future is looking very positive, which is also very exciting. So with that, I'll kick it over to Todd to jump in about elections.
Thanks, Tanae. Good morning, everyone, and happy Friday. I'll start off with House Bill 1071, the ranked choice voting bill. That passed Senate Finance as amended on the 19th. The first amendment, Amendment 11, would move the funding for ranked choice voting from the Colorado Department of State's cash fund, and it would be funded now by the general fund. The second amendment, Amendment 12, relieves the Colorado Department of State from the responsibility of developing a cross-county tabulation system, and instead places that responsibility on the coordinating entity's designated election official. This would essentially require the coordinating entity to develop a system to combine ranked choice voting tabulation results from multiple counties, and it effectively makes ranked choice voting highly unlikely for school districts because county clerks are required to run any school district elections. Senate Bill 250 on elections and voting passed out of the House Finance Committee on the 20th unamended. It will proceed to the Appropriations Committee in the House. We expect a late Colorado Department of State bill to provide for county redistricting in 2022. Now, this will not affect our redistricting or our reprecincting in Broomfield because we're home rule and we're not as dependent on census results, but it may change the date of the party caucuses and the primary election. So we expect that next week. No update on the For the People Act, no recent update there. We will include in the written update today, the known initiatives that are already being circulated. So far, there's 4. And you might have read that initiative number 38 was denied its title on the 19th because of filing errors. We expect the proponents to resubmit this initiative, and it's a doozy. It would take Colorado back to the 1970s version of voting. So that's all I've got for elections for today. Thank you, Danae.
Great, thanks, Todd. Any questions on the elections bills before we move on? Gina, it looks like maybe you have one.
Yeah, I guess with the school districts, the fact that we couldn't do the ranked choice voting with the school districts because the funding went, it's not going to be handled by the state, it would be local. Do you know, was there any interest in general from the school districts of using ranked choice voting, or?
Thank you, Councilmember Lib. The reason that school districts would have difficulty running a ranked choice voting election isn't because of funding. It's because the onus on tabulating cross-county would be on the school district themselves. We do understand there's some interest from school districts in running a ranked choice voting election. We also, there are enterprise solutions out there, but school districts would not be able to use those enterprise solutions like a cross-county municipality would be able to.
Okay, thanks.
You bet.
Great. Any other questions? Hi, Lori. Glad you were able to join. Okay. All right, we will continue on then with just general updates. Thank you, Todd. We're going to start off with criminal justice reform bills. There was a lot of news coverage around this front this week. So the first one was House Bill 1251, which was the appropriate use of chemical restraints on a person. So it specifically limits the use of ketamine that we talked about. It is finally scheduled for May 27th in the Senate Judiciary. There are still concerns about this bill, so we are monitoring and we'll see how that hearing goes in the Senate committee. Also, House Bill 1250 is called Concerning Measures to Address Law Enforcement Accountability. If you've seen it in the news, they have commonly referred to it as the son of SB 217. Essentially, it broadens the requirement for law enforcement officers to use body-worn cameras to include wellness checks. It expands data collection requirements, and it does expand reporting requirements and the liability for local government. It's looking at possible mandatory indemnification of an officer that has been convicted of a crime. So there's a lot to this bill. We're still processing it, but we will continue to track. It is scheduled for May 25th in the Senate State Veterans and Military Affairs Committee. And in your CMO update today, there's a Colorado Politics article that we've also included that has a lot of information from the bill sponsors. Senate Bill 183 is the other law enforcement accountability bill. So largely the 1250 was introduced by the Democrats and has kind of been having momentum, although they are hoping for bipartisan support. Senate Bill 183 is kind of the Republican version of the bill. It finally has been given a hearing date. It was parked since March, and finally has a hearing with the Senate State Veteran and Military Affairs on the 25th as well. So the Senate State Veterans and Military Affairs will hear both of those bills. So the House Bill 1250 and Senate Bill 183 on the 25th. And I think seeing next to each other in review is where we'll see which one's going to continue and which one is not. So we will continue to monitor and provide an update. Another one that we had talked about before was House Bill 1244, which is the restrictions on collection and use of biometric information. From the minute it was introduced, there was a lot of opposition from Chief of Police, law enforcement in general. It was postponed indefinitely. So that bill is no longer moving forward or on anybody's radar. The next one that we had talked about, and specifically Devin had brought up, was Senate Bill 2162, which was the jail population management. It was pretty much a response to the COVID policies that were put in place and looking at extending those long terms. We talked about this because there was a lot of controversy around it. It pretty much was parked for several months, where Senator Pete Lee was working with the Chief of Police and other stakeholders to try to come to agreement, but there wasn't a lot of compromise. So just earlier this week, Senator Pete Lee, who's out of Colorado Springs, came out and said, no more, we're scrapping it. So instead of trying to amend 62, they're scrapping it, and they introduced two new bills instead. So one is Senate Bill 273. We're calling it the do-over bill. It is significantly different from 273 or from Senate Bill 62, and addresses a lot of the concerns that police and enforcement had in the original bill. Particularly, it omits the class 4, 5, and 6 felonies, which are the lowest felonies in Colorado law from the bill. In addition, it looks at safely increasing community response in lieu of law enforcement engagement for lower level offenses. And it calls for service when there is no criminal conduct. So we'll monitor that bill. It was just introduced this week. And then the other bill that kind of is in that same category is 271, which is misdemeanor reform. They're going to be heard both later this next week. And this one addresses what's included in those low-level felonies. So 273 is saying that 4, 5, and 6 felonies will no longer be included in this jail population management legislation. And then 271 essentially defines what low-level felonies are and misdemeanors and what categories or class they fit into. So they kind of go hand in hand and help clarify where a lot of legislatures and enforcement has said there's been confusion. So those were big ones this week, and we'll continue to monitor those as well. And now I'll pass it over to Shaylee to talk about a new bill that was introduced. Well, it's actually an old bill. It was introduced in February, but is gaining momentum this last week.
Hi, everyone. So as Danae said, it was introduced in February and it's gaining momentum. It's currently parked in the—
Hey, Danae, it's really hard to hear Shelby.
Okay.
Oh, I'm so sorry.
It's okay. It's all right.
Yeah, so it's House Bill 21-1068, insurance coverage mental health wellness exams. It's currently parked in Senate Appropriations, and it's currently not scheduled, but it has a ton of support. Insurance companies would be required to cover yearly mental health screenings comparable to physical checkups or other preventative care. Insurance companies could not collect deductibles or co-payments for insurance payments.
So it's a really exciting bill around council's priorities around mental health, right? So again, making it more part of our structured insurance policy coverage to increase, increase access essentially to mental health services. So I know for council in general, that's been a thing. And Kim, I'm looking at you specifically. I know that's something you've brought up. So we were excited. It was, like I said, it was introduced in February and we really hadn't seen any momentum behind it. And then this last week, it's just really moved through. So we'll keep watching that one. And great job, Shaylee. Thanks. Any questions for Shaylee about that one? No? Nice job. All right. Let me jump back to the notes. You have a really loud person in me and then a really quiet person in Shaylee. So sorry with the mics. So then the next one we wanted to talk about, and Jean, thank you for bringing this up. And Lori, I know you brought this up earlier in the session, but House Bill 21-1317 was introduced. It's regulating marijuana concentrates. And there was a lot of articles around this. The Colorado Sun and the Colorado Politics covered it as well. It's really aimed at curbing teen use and adult overconsumption of high potency cannabis. So it's a little bit different than we have seen in any of the other potential bills or bills that have dropped on this topic. They're not specifically looking at capping potency levels at this time, but first they're creating the Colorado School of Public Health. They're giving $1 million per year for 3 years. So it's a $3 million allocation to research the impacts of high potency marijuana and create a scientific review council to make recommendations on maximum potency levels. So again, going back to looking at, right, what should the regulations be on potency? And so this is putting the dollars into research to figure out what that could be and have a recommendation. It also requires coroners to screen for THC in their toxicology reports for anybody under the age of 25. And again, this is focused at curbing teen use and overconsumption. So for medical marijuana patients under the age of 21, it also requires that they meet with 2 different doctors. They have to have a follow-up 6 months after they get their medical marijuana cards. So just a few more check-ins throughout the process before you get that card, and then after you get the card to make sure that it is meeting your needs and you know, it's within reason to again curb that teen use and overconsumption. Another requirement is that doctors need to review their mental health history for their patients, in addition to their physical medical history, before they can give that medical marijuana card. So it's a big bill. It's parked in appropriations right now. A hearing date is not scheduled currently. But we know with Broomfield starting to accept marijuana license applications on June 25th and the priorities of council, this is a big one. So we will continue to monitor this one as well.
Nate, and you can clarify too, because I think there was some confusion out there about the age on that. That was for a very specific age. The study covers everyone, but some of their emphasis was on the teen, young adult use, correct?
Yeah, I think the biggest was 25 and under, Lori, but it did have different age categories depending on what part of the bill. So it's not a general statement across the board. So I can try to tease that out for you a little bit more, what the age groups are per each requirement. I don't have that off the top of my head.
That'd be helpful. Thank you.
Yeah, of course. And it looks like it does have bipartisan support. So it will be interesting to see, right? They've identified the challenges from past bills or proposed past bills that really kind of stopped it from progressing and kind of got rid of that. I always hear Jennifer saying the devil's in the details, right? So kind of got rid of those things that were stopping people from making progress. And that's the hope, is that this can finally proceed. So we will continue to monitor, and I'll look at those the specific age requirements. Okay, next, just wanted to talk about, because Guyleen asked about these last week, was around the access to public opportunities and lawful presence in the U.S. We had talked about them originally. There were 2 bills. One was Senate Bill 21-199, which is remove barriers to certain public opportunities. And then the other one was Senate Bill 21-077, which was remove lawful presence verification credentialing. So Senate Bill 77 was the laser focused bill that specifies that lawful present verification is not required for credentialing applications for regulated professionals. So it was very specific. It was to get your license that you don't have to have lawful presence verification. It's already been signed by the governor. That one had a lot of support out of the gates because, again, it was very laser focused and addressed some of the concerns that were brought out in COVID. Senate Bill 21-199 was the very broad bill that had lots of concerns because of the broadness of the bill. It did pass the House. It did pass, and it's scheduled for today. I misspoke. There is no hearing scheduled as of today. But essentially, Senate Bill 21-199 would repeal the prohibition to provide state and local benefits to unlawfully present individuals. And so it is a blanket. It covers everything from professional licenses to public work contracts to local business licenses. And then it also addresses what identification can be accepted. The concern from CML is the unintended consequence that there could be a mandate for cities to provide this. which is problematic about local control and then cost. So again, we're monitoring this, but as of right now, it is not even scheduled. And then the last ones I just wanted to talk about specifically are transportation, and I will not be near as knowledgeable as Sarah Grant on these. So, but it has been a very big week for transportation. So Senate Bill 21-260, which was the sustainability of the transportation system. Council took a formal position of support on that bill on 5/11, and it passed the Senate this week, which was really, I mean, that's a huge, huge accomplishment. So it is scheduled for the House Finance Committee next week on the 24th. And so we are continuing to monitor. I do want to let council know it will also be in your CMO weekly update. We did put together a letter of support and submit it to all of our representatives as well as sponsors of the bill. So they are aware of council's formal support on this legislation. And then the second one is Senate Bill 21-238, which was the Front Range Passenger Rail District. As you are all aware, council also took a position on that bill. And we just received a message from CCAT. I wish Devin was here because I know the CCAT Transportation Committee is looking at this, but they are proposing an amendment. So it's scheduled for its hearing next week. It sounds like Devin's going to be testifying. The proposed amendment is to add a I-70 coalition representative as a non-voting seat on the commission. In the past, this has been declined, is my understanding. So we will see how this goes. So CCAT right now is collecting feedback on this bill. And as I mentioned, Devin is planning on testifying next week. So we should have more information on the Front Range Passenger Rail bill early next week. Let's see. Few other just general ones, the income tax ones. So House Bill 1311 and 1312. One is on income tax and one is on insurance premium property severance sales tax. As I mentioned when we started this call, Devin reached out about these. They are pretty complex bills. So I am working with staff to get more information on this, and we hope to have an update to all of council in the legislative update today. And if not, we'll provide information at the council meeting on Tuesday next week. Let's see, I'll stop there. Any questions so far? I guess the only other one I should address, and I apologize, Heidi, I have them on my list, and we also did provide a letter of support, was 21-200 that council also took a position on, and I'm sorry, it was at the bottom of my list, but we did get letters of support immediately following council's action last week, and you'll be able to see copies of that letter in the weekly update today. But it is scheduled for today. And when I'll be honest, I had a dentist appointment this morning, so I wasn't able to listen to any of the committee hearings, but we will see what the update was out of today's committee work and provide that on the Tuesday update at the 25th council meeting.
Thanks. Yeah, we talked about it at CC4CA, and it sounds like Polis is opening up to the idea. Funny how that works. But there will probably and likely be some amendments on it. But I've been actually out of the loop on that, so I need to look into that a little bit further. But I'm going to get with Jacob today from CC4CA and try to figure out what exactly is happening. I'm so used to just like being there at the Capitol and watching it go, and we can't always do that. But yeah, it looks like Polis is kind of, saying, all right, but let's figure something out. I think, yeah, he's a little libertarian when it comes to, he wants more carrots than sticks, and he's also a business owner, right? So anyway, so we'll be looking into that, and hopefully Polis will come around.
Yeah, it is interesting to see it kind of when he was, when they had the rally on the Capitol steps, it gained even more momentum. So there is power sometimes in the opposition, right, to gain more support and more vocal support. So I haven't seen anything out of the governor's office as it's continued. And with the hearing today, normally there's more vocal opposition. So I do think that that's a good sign. And Heidi, if there's anything with CC4CA, that reminded me, I'll make sure Camille has it, the letter as well. And if there's anything else that we can do on that front, please just let me know. Awesome. What else do we got? Any other questions today on legislation? There's a lot going on, so if we missed any, let me know and I probably will need to do some research and get back to you, but we'll make sure that we get whatever bills you all wanted updates on.
So I have my hand raised, but I don't know if you can see it or not. I just wanted to revisit the mental health one that, and I'm sorry I didn't catch your daughter's name.
Oh, this is Shaylee.
Shaylee, thank you, Shaylee, for presenting that. Exactly, can you go over that? I know we go over these so quickly and so fast. I wanted to slow that one down and just really understand that one and what all that will cover. And where is that at again? I think you said it passed.
So it's, yeah, let me just start from the beginning. So it's House Bill 21-1068, and the title of the bill is Insurance Coverage Mental Health Wellness Exam. And so it was actually introduced back in February. Let me check, it was introduced on February 16th. We had saw it back then and then nothing had happened. And all of a sudden last week, it started to gain momentum. So in the last week, what has happened, Kim, is it was unanimously approved in the House Health and Insurance Committee. And then it was given bipartisan support in the House Appropriations Committee, which is really, really exciting. And it is, let me see where it's scheduled.
And you were saying, well, I think your daughter was saying that this would waive copay, so you wouldn't have copay for this?
Yeah, let me read the summary let me pull it up really fast so I'm reading the actual language. So it requires that state regulated health insurance plans provide coverage for the total cost of an annual mental health examination. So, right, similar like we see with preventative physical health checks, it's the same, they're mirroring that process for mental health checks. And essentially, let me go down here. So under current law, health insurance carriers offering individual and small group health plans must ensure that coverage includes behavioral, mental health, and substance abuse disorders. While some of the level of coverage is required, carriers are not required to provide coverage for the total cost of the services. So that's what it's getting at, is that total cost of those services. So that it requires the total cost of an annual mental health examination of up to 60 minutes is covered. So it is very laser focused. It's not just a general bill on mental health, but specifically an annual mental health examination for 60 minutes is covered total cost. And then the bill does go on about it has to be performed by a qualified mental health provider, and it defines who that is under the law. So, it's counselors, a family therapist, social workers, psychologists, physicians, physician assistants are all on that list. And again, it is to just make sure that people that, we all need a mental health check. And so it's removing the financial barrier that it is covered for that, at least that initial exam.
All right. Yeah, I'm kind of concerned why they have physician and a PA on there for a mental health check. But that's great that at least they have the ability to go to a provider. Interesting. Good.
And it does, Kim,
the start.
The specific language on the physician is it's a physician who has certification or training in psychiatry or mental health or behavioral health. And the physician assistant has to have training in those categories as well. So it's not just a blanket physician, it's somebody with that training.
Oh, perfect. Okay. Well, at least as a start, I'd like to see, insurance companies doing something a little different, but at least we're taking a step. Perfect.
Yeah, it's interesting in this post-COVID world, right? Like I think mental health, there's been a lot of challenges with COVID, but in some of the good, right, is that there's been a spotlight put on mental health and our access and our systems. And so as we come out of COVID, we're seeing a lot of momentum behind behind legislation. And to your point, Kim, it's not perfect and it's not where we need to be, but at least we're finally starting to take some action.
Yeah. I'm wondering if this one we couldn't get in front of council and see if we can't get some support. Whereas where is it at in the process? You said it's gaining momentum, but
Yeah, let me
Maybe Broomfield can.
So in the last week, so it passed the House and it was introduced in the Senate. On the 19th, the Senate Committee on Health and Human Services passed it unamended to appropriations. So it's currently parked in Senate appropriations. And I honestly need to look at the Senate appropriations calendar to see, I mean, before they were jammed up with the transportation bill, that's moved through the Senate already. So I don't know what other big items is on their docket. But the hearing date for the appropriations has not been set. But again, like I said, this was introduced on the 16th, and then from the 14th to the 19th, it went through House committee work, committee of the whole, and is into the Senate.
So it might go through appropriations before we meet again.
It could, and to your point, though, it does align with council priorities around mental health. So, right, that's why we adopted those policies on the front end, so that staff does have the ability to be more reactive quicker, especially at the end of the session when things are moving very fast. So I'll make sure to have this on my list for the Tuesday legislative update, Kim, and then if at that time, just like we've done in the past, you can just, if you want to actually take a formal position, more than just what's already been adopted in the policy statements, you can make that motion on the floor Tuesday.
Okay, perfect.
That process has worked out nice. It was a little bit of a transition, but it does help us be a lot more reactive with legislation and positions. So thank you to everyone for adjusting to that. Any other questions or bills that maybe were missed? See, maybe Jean?
I guess I'm enthusiastic about this introduction of this mental health bill too. I guess my skepticism would be, are there going to be enough mental health providers to even offer this service? I mean, we have, as you know, as far as I'm aware, we have a dearth of mental health providers, you know, to offer services to begin with. And then, you know, this, I'm glad this will provide more equity for people, but are we going to have people to do all these 60-minute screenings that people might want? I wonder if there was any testimony about that in regard with the bill.
Yeah, I'll be honest, I don't know. I think that's a very valid concern. I haven't seen this one even in the news that much, which has been interesting. And again, I think it's because it just kind of started taking off last week. But I can do a little research and see if I can find anything. But from what I've seen, I have not. That wasn't one of the concerns. I know there was concerns about the cost, right, on insurance providers. And as you're all aware, there's a huge insurance bill moving through the legislature. And so keeping those kind of separate and not having one get sucked into the other. But I haven't heard about that on this one specifically, but let me see if I can find anything about that specific topic.
I had a question too. I am also excited about this mental health awareness, just sort of, you know, really taking shape. I think it just has to be a normal part of our conversation. And I'm wondering if that could even, well, I'll share those thoughts later, actually. I did have sort of an alternative question, and I don't know if you have the answer today, and if you don't, it's no big deal. I am hearing that, you know, we hear about fiscal notes, which is great. I'm hearing that we also are starting to get climate notes, and I haven't read those, you know, from the Capitol. And then the reason why I'm asking my next question is I'm wondering if we're going to start to get equity notes. So I even think that we can even incorporate that into a lot of our developments too. You know, what does equity look like? What does, you know, our sustainability look like? And the reason why I ask is because I had this weird conversation with Councilmember Candy C. DeBaca, and then also the commissioner out of Adams, and I'm forgetting his name. It's not Abe, but it's the other one. They were both actually against the transportation bill. So it was like this far left and sort of a right-leaning people coming together. And for Candy, it was more like equity, you know, with the transportation bill, like who does this, you know, affect with these fees, and what does equity look like in that conversation? So she was actually a no on the transportation. And then the other guy had some other reasoning, but I just feel like it would be interesting to see if we can get, maybe some sort of talk about what does it look like for equity when we, look at bills and those sorts of things. And I'm going to be pushing back on, what sort of notes can we get? Because I think it's important to know, the cost of things, which is, of course, everyone looks at the fiscal note of things. How much does it cost the state? We're also looking at what does it cost our climate? And then I'm wondering if we can look at it through an equity lens. So just something to think about. I don't know if you've heard about the climate notes. I haven't actually seen them yet. I just kind of heard about them this week. But I don't know if bills are going to start to come out with those sorts of things. So.
No, Heidi, I think it's like the ongoing struggle and challenge, right? In a good way. But as you see the new memo templates with council that we talked about in February, right? You'll see those starting June 1st of, again, us trying to show the intersection of all, because you're right. Transportation does impact equity and access, and then it does have an environmental impact. And so how do we connect those in a way that's thoughtful and strategic? And so I'm looking at Nancy because we just had this conversation, I think, on a call yesterday that we are trying to figure out how do we look at the intersections and connect them, but again, in a way that's thoughtful and not duplicative, right? Because there's also that challenge as well, especially from a capacity level. So always good to bring up. So thanks for the reminder. And we do try to look at it through that lens. I must say, from tracking the legislation, the adopted policies of council, and then knowing your priorities really, really helps, right? Because that's kind of the lens I'm looking through of, does it trigger this or this? And then how does it combine, right? Underneath all of those categories or just one, because it's rarely just one, which you'll see we kind of moved away from those themes in our, when I started, I could do it as transportation or housing, and we kind of aren't able to do that anymore because it doesn't fit in these little boxes. So, which is good. That's a good sign. We need to be more mindful. So
yeah,
thank you for the reminder.
Definitely. Thank you.
Anything else? Okay, I think that's all I had. We will provide an update at the council meeting on Tuesday. So Kim, I made a note about the mental health and Lori about the ages. It looks like Lori jumped off. So I'll do some research and then also Devin's request. But if there's something in advance, if you let me know, it gives me a little more time to research. These bills are pretty complex and long for the most part. So a little advance notice is helpful. And if not, we'll address anything that we missed on Tuesday. And I hope everybody has a great weekend. And thank you, Shaylee, for being our intern and for presenting the bill.
Yeah, thank you, Shaylee. Oh, can't hear her.
I can't hear her, sorry.
See, I said next time I'll work on speaking up, but apparently I just need to move closer.
Maybe we'll see you Tuesday night.
That would work. Awesome.
Guys,